Well, hello and welcome to this my MaleSurvivor recovery webinar. This this meeting is dealing with issues in the trans community, and we have three panelists. Lexie Bean, who's a queer and trans multimedia artist, originally from the Midwest. Their work is film, literature, and curation, revolves around themes of bodies, homes, cyclical violence, and LGBTQIA+ identity. Lexie is a Lambda Literary Award Finalist for their work with trans survivors, and continues to speak at universities on trans inclusion in the Me Too movement. Charlie Hidalgo is a Colombian trans man, award-winning producer, writer, and educator, or director rather. His upcoming feature film, for which he wrote the autobiographical screenplay, is called Honor Thy Mother. Devin-Norelle is a Colombian trans man, award-winning producer, writer, and director. His upcoming, I'm sorry, I'm reading the wrong, he's a professional model, advocate, media figure, public speaker, and opinion writer with published work in GQ, Teen, Vogue, Allure, Them, and Out magazine, among others. And I'm going to ask Lexie to lead off, and because Lexie is the person who contacted us and really initiated the development of this webinar. So Lexie, do you want to take the phone?
Sure. I would first want to, Devin-Norelle, if you're open to this, I would love it if you were open to leading a moment of silence and remembrance of Tony and other people who have been lost to violence, particularly around asking for help, race, low income. Go for it.
Sure. Yeah, so let's certainly take at least a moment. I mean, we could also take 8 minutes for George Floyd. No, I'm kidding. Let's take a moment of time to think about Tony McDade, who was a trans man in Tallahassee, Florida, who became a victim to police brutality, unfortunately. Also among trans people, the trans women that we have lost in the past 2 or 3 weeks, Dominique Fells, Rhea Milton, I believe a young 17-year-old named Breonna Taylor that we just lost over the weekend. And the other 15 or so trans women, mostly of color, and trans men that we have lost within this past year. And it's only been half a year. So if we can take just a few moments to think about those folks that we've lost, the folks that are deeply affected by this pandemic, the folks that are affected by the protections, the health insurance coverage, and that has been rolled back by the Trump administration, that will be in the middle of a pandemic. Also, we should mention, let's think about all those folks as we just take, I would say, about a minute to reflect. Starting now, 7:04. Since we are, since the nation is right now talking about police brutality, I just want to bring up a couple of stats as we are thinking about this. Black people make up about 13% of the population of the United States, but are 24% of the victims that are subjected to police brutality. And trans people are 7 times likely to become a victim of police brutality or other violence. So please consider that as we continue this panel tonight. Just keep that in the back of your mind. There are some other stats that I will also share in terms of the lack of access to employment that we don't have, housing, education, public restrooms, etc.
Thank you. Yeah, and for anyone who might be questioning, like, what does this have to do with sexual abuse? It's everything to do with sexual abuse, because housing stability has everything to do with survivorship, the ability to ask for help or to receive justice, whatever that looks like for any person, is related to who can talk to the police. It's, yeah, so it's everything Devin-Norelle just shared is deeply connected to everything that we will dive into. Charlie, would you like to add anything before passing back to Murray?
I think you said it. I think we can continue. Thank you.
Thank you. I also wanted to introduce Lee Friedman, who's here as a sort of support and technical advisor. We have a number of questions that came up in preparing for this, and I guess one of the lead-offs is I would like Lexie to discuss their book, The Ship We Built, and it's kind of way of contextualizing the life of the trans life of a child. And I know it's, much of it is sort of autobiographical, I think. Lexie, do you want to speak about it?
Sure, I can speak for a second, and I think most of all I want to use because I don't want to center my book in this event, but I can use it to offer context or a launching point for a larger conversation. It's called The Ship We Built. It came out a few weeks ago, and it's the only middle grade book centering a trans boy that was written by one, which is a lonely place to be. My personal journey and to in the ways that I have offered that to the narrator Rowan. I think for me, one of the hardest parts of my coming out process and being okay with myself is that I am a survivor of childhood sexual abuse, and I've been really afraid of becoming the thing that has hurt me the most. Yeah, it's overwhelming sometimes. And I would love to pass it off to anyone else who would like to share or offer resonance or offer a different perspective or experience.
It raises a question that has been raised many times by men who were sexually abused, particularly as children. And one is, how much of an impact, if any, do you think it had on your evolution, your gender choice, your sexual orientation, anything in between? Do any of you want to respond to that?
I would add to what Lexie said. I identify so much with that. When I came out when I was 33 or 34 years old. And for so long, I said, if I was a kid, if I was younger, if time wasn't what, I always thought that I would do it. I could never, I just didn't have the support to transition. The people around me didn't want to see it. But in terms of me accepting to be a man, it was absolutely directed with how my experience has been with men. I have very few positive experiences with men in my life. Very few men in my life are good people or haven't hurt me. And usually people tend to believe that it is the abuse what made me trans, but I don't think that makes any sense. What happens is that we hold up on being who we are because of the abuse, because we don't want to be a monster, because we don't want to be that kind of man, because we don't want to be any of the things men are for the most or represent. We and our families have suffered through life because of that. How do you become something so ugly? How do you accept you are also a man? So I absolutely identify with that, Lexie. It resonates so much. And I can say that the only reason why I didn't transition early was because of my relationship with men. And the only part that I feel that I still have to work through is that, because everything else about my transition has been a positive impact in my life. Everything else.
Since you brought it up, Charlie, it raises the question of what is masculinity? I mean, it can't be all bad. Not all men are abusers by any means. And it's easy to see why it would be difficult to contemplate shifting to being male when males have hurt you so much. But I guess what is it in masculinity that you're striving for, I guess? Because to transition, must be something you would consider, I would think. I mean, otherwise, being male all the way from birth till now, it's not a question one asks very much of oneself. So, anybody have an answer? We're all contemplating what.
Well, I can go but I already spoke a lot, so yes.
Go for it, Charlie.
I think that there are good men, and I am trying to get in contact with those who are around me and I can learn from, and validate this concept of masculinity from another angle. I think that I make this joke that trans men, but I do believe this, that trans men are improved men. I think that trans men are men. I want to make t-shirts for improved men, because I think that's what we are. We understand the experience that women have, and we understand the experience of the disenfranchised and the oppressed. So our awareness, it's very big, and there is a lot that society can discover and learn from our perspective if we're given the chance to tell our stories and for our voices to be heard, like today you're doing here. I personally think that my mission in life is to improve men, cisgender men. So I have started my campaigns for them to wash their hands, and then coronavirus happened, so that helped me. So they are doing it now more, which I celebrate when I see. But I think that we trans men, we shouldn't have to be doing this. Unfortunately, we it's part of our daily lives. When you start to be seen as a man, you start having conversations with men, and those conversations that are around sexism and all of these things can be difficult conversations to have. But I feel like each of those conversations when we can manage without going against our health or any, putting us in a bad position. I think that there's a lot that cisgender men can learn from us. And I am just waking up every day to love myself and to be the best man I can be for me, for my partner, for my family, for my community. And I think every single cisgender man can do absolutely the same, because we all have the capacity to understand each other's pain.
Can I hop on what Charlie was just saying? I totally believe that. Obviously, there's a lot of conversation right now about toxic masculinity, and I totally believe that masculinity in and of itself can be very healthy. And I do agree with Charlie in that trans men and trans masculine people do prove that point. In that, a great story I like to tell is, for instance, men make an excuse sometimes about catcalling, and that, well, you have a high sex drive, and so that's something that occasionally you do experience when you're first taking testosterone. But although the sex drive is not wane, you can still, in this state, learn to respect a woman and to treat a person as a human instead of objectifying them, instead of catcalling them. And so this is a point that I have made to a cis het friend of mine. Why are you staring at this person? Why are you catcalling them? They don't want to be harassed. And then kind of then excuse it with, oh, I have a high sex drive. Well, I do too, but that doesn't give me an excuse to behave a certain way to women. Trans men are excellent examples of how to dispose of your misogyny. Because I think sometimes we have learned in the past, we've experienced it, and we take it with us into our transitions and say, this is what I didn't like, this is what made me feel uncomfortable, and I don't want to make another person feel that way either. And so I will absolutely have to agree with Charlie on that.
Yeah, and to expand on that, as somebody who hasn't medically transitioned, I still experience misogyny all the time. And that's been a big part of my coming out process is, oh, you're a confused woman. And when I came out as trans, there was the idea of, Charlie said a little bit about this too, like, you are this way because you were abused. And ultimately you're just a confused woman. And that haunts me every freaking day of my life. And I think that's why in a binary world, in an imagined binary world where like that was created and invented and it's not a natural thing, trans people are put in positions to have to overcompensate in order to be considered real. And I think in particular for trans boys, men, or just assigned female at birth trans people, there's so much pressure to put up a masculine front in order to be considered real. Otherwise, one receives this extra layer of misogyny that is really painful and hard to talk about, and within the survivor experience is really hard. In my experience of doing anthology curation, specifically working with trans survivors, I noticed that it was a lot of assigned female birth trans people who didn't want to participate in the Me Too movement because it was women-centered. And in order to claim their experience as survivor, they had to claim womanhood. And it's a mess. And yeah, as someone who hasn't medically transitioned, it feels really complicated to walk between these worlds. And just like Charlie, my biggest barrier for that is not really, not feeling totally sure what I can become or want to become. So
can I ask, Lexie, if any of the folks that you worked with, especially the people that did not want to get involved with the Me Too movement, did any of them have reservations about getting involved, not just because of having to invalidate themselves as men, because they would have to claim themselves as women again, but also was there a level of, I would feel invalidated because masculinity tells me that as a man, I can't be sexually assaulted. It's not a masculine thing to admit to that. Have you encountered any folks that would or felt that way?
totally, yeah, and especially in framing it as enoughness, because I think that's part of the masculine framework of it too, is like, oh, like that wasn't anything, or like, oh, like that didn't bother me. And a large part of the process, especially with anthology work, was validating people's enoughness, both of being trans enough, but also survivor enough. Oh, you're on mute.
Sorry, I was just saying that, you know, like it's disturbing to hear and it's really sad. And I really don't know how to react to that, you know. It's almost as if trans masculine voices are in other ways being erased again and again and again, and they're self-silencing themselves. So it's just really terrible to hear that.
Yeah, and I think again it goes to like how we have experienced a lot of cisgendered men growing up, of like how much space is taken and therefore like not wanting to emulate that, and then therefore making yourself disappear. It's this really wicked cycle.
Well, that raises for me a little question about the character of Dylan in the book, who seems to be a kind of idealized, heroic male figure who never weakens, never falls, never, you know, he's sort of like perfect. And I just wondered what ultimately you feel about that character. That kind. He's a boy who's 10, going on turns 11, I guess, and but is so sort of self-assured and is such a ideal figure for Rowan. But it never really, I mean, he never recognizes Rowan other than a little teeny bit, calls Rowan by the name Rowan, but it's not, yeah.
Totally. To contextualize this for anyone who hasn't read it, and also just to make it a little bit more like of a broader conversation outside of the book, Dylan is essentially a character who like I have been drawn towards in my life in terms of attraction, of being like, oh, everybody else likes this person, so therefore I'm gonna like this person because it's safe. But the reality is this person isn't safe to like because he doesn't feel in real time or express it, and is quick to grab onto control, which is quite normal for for especially young boys who are learning masculinity quickly, or certain ideas of masculinity quickly. And I think the way that I would want to draw this into the larger conversation right now is the tendency, especially for trans people, not just, I think all trans people to a certain degree, gravitating towards abusive relationships, because that's the person who remembers your name or your pronoun once, or that's the person who like offers what one thinks is deserved. There's a line somewhere in the text where Rowan says, Dylan reminds me of home, which is weird because I don't even like my house. And that has followed me throughout my childhood, teenage years, adulthood, of staying in things because because why would someone want to be with me, especially if I medically transition? And this is especially inspired by someone who I was with at the time of coming out, and all the internalized homophobia I felt from that person, and to be in a situation of being in like a straight relationship and then telling that person, no, actually this is a gay relationship, and getting the feedback from that, and holding that disgust towards myself because that's what is being thrown, is really real. So that's Dylan, but that's also so many people from life itself. And I'm curious, if Devin-Norelle or Charlie that resonate with this or not.
You're muted.
Sorry, I keep forgetting. Sorry, I just wanted to clarify the question. If it's familiar to fall into the cycle of abusive relationships.
Yeah, or this sort of like love that's normalized, or attraction that's normalized, even if it's abusive or unhealthy.
I want to say yes, but I think my yes comes from varying reasons. I would say mostly because I grew up in an abusive household. And so being accustomed to chaos as a child, that is what is familiar to me as an adult. And yes, that could play into abusive relationships or staying with someone because they are not misgendering you or dead naming you. It's like, here's all of these bad things that I'm familiar with, and maybe I'm staying because of that too, but also this person is using the correct pronouns. This person is validating my identity. So maybe it's not that bad because at least I couldn't get that at home, but I can get it here. And have certainly been in relationships longer than I needed to have been, especially at the beginning of my coming out and the beginning of my medical transition, because I felt that my identity was validated in ways that not just home, but other friends wouldn't validate. I don't know if that answers your question.
Definitely. Thank you for sharing.
I have had two kinds of experiences in terms of relationships, and I'm going to try to be brief. I was in a long-term relationship with a woman, and we had been together for almost 5 years. And I went to buy a binder and I brought it home. And when she saw it, she hid it. So I asked what happened, and she said, I will never forget this image of her turning around and saying, I just can't deal with that. And this is someone who said to love me to death. And that day I knew that our relationship was over, that she did not love who I truly was. And this was also coming after one of the last issues we had, which was that someone said that I was a person of color and she was offended. So these two things happened. This is a very white Canadian woman. So I understood that my identity was a fundamental issue for her, and for me the relationship was over. After that, I met a woman who has changed my life, and I never had to say anything to her. By my behavior and the way I wrote to her, and she understood how I referred to how I saw myself, even if there was not a word of I am trans or I am a man. And I remember that the first time that we woke up together, she called me handsome. And since then, she only helped me to she only hold me strong for me to be able to say who I am. And every time that I wanted to put a movie, a script, a visit to my family, or any other reason prior to my medical transition or any other need that was for me to achieve, to feel myself, she pushed me, she always made me put myself first. So I think a person can destroy you and keep you in a box and make you believe that what they're doing you is all there is for you. But as long as you wake up feeling like that, and maybe no angry, no happy, not nothing, just that, you are in the wrong place. And when we know who we are and when we're proud of who we can get anything we want because we're so beautiful and so deserving of love. So it's about getting those toxic people away from our beds and making space for ourselves and the people who can truly see who we are and love every single bit of that.
That was beautifully stated, Charlie.
Definitely was. And I was thinking, I'm still sort of stuck on, in a way, on this Dylan character because Rowan never penetrates the male environment that he was living in. And I recall being 10 and 11. And what I remember about that period was how many times boys are sort of humiliated or basically trained not to feel and not to show emotion because if you show weakness, if you cry, if you, and this is certainly true about my abuse, is that you're regarded as a girl or a fag, but as a girl, a pussy, you know, anything but a boy, anything but male. And I think that that shapes a lot of the ugly parts of what men grapple with in one way or another growing up. And I think adding sexual abuse only makes that struggle to feel comfortable in your own identity. I can imagine that I can't imagine, but I assume that being or heading toward trans isn't, or being trans at whatever age is, or has to add another level of kind of, in a way, terror of assuming that identity because it has so many kind of negative things. It's negative about women, but it's also negative about being a man. So, you know, being male. Anyway, I had a question though about stages of trans, because I know, Lexie, you mentioned that you haven't gone through medical transition, whereas you, Devin-Norelle, have. And I'm wondering how does one do that and why? And I mean, how does that figure in the realization of being trans?
Is that question directed to me or Lexie, both of us? Can't hear you.
It's all of you, any of you. Go ahead,
Oh.
Devin.
Let me think on that actually for a second. If anyone else wants to go before me.
Do you want me to go, Lexie, or do you want to go?
Yes,
And then
go for it. Go for it.
you can go, and then I can close.
You can go ahead. I support
Okay.
you.
It's a very interesting question. So I think that being trans does not require any medical transition. Medical transition is a choice, and for some people it's a need. In my case, I needed top surgery or I was going to kill myself. I was living like if I had 2 heads or 10 heads. I was living with an issue that was extremely damaging for me in every single possible way. So for my mental health and for all of the reasons that I needed, I did it, and it's changed my life, and it's the best decision I have ever taken. And if I could go one day back just to win that day, I would, because it had changed everything for me. It was worth everything. But there is so many people who love their body just as is. You know, my issue with my chest was also very, very related to the abuse. Most of the abuse that I was submitted to in my early years happened on my chest. So it was a constant reminder, not just that I am a man, but that was also a constant reminder. So for people that have suffered abuse, this can add another level of dysphoria, right? So that happens, but we are who we are, no matter if we take tea, if we go through surgery, if we, you know, like how we present ourselves, it doesn't change who we are. And I think I lost the end of what I was trying to say. But there is no stages, I guess is what I'm trying to say. For many people, clothing is the only way to reaffirm their gender, which is completely directed with not being violated on the streets, with having fair chance at a job if you are able to present according to your gender. Even so, there is no clothing for trans people. There is nothing catering to us. But that is, I would say, clothing is the most needed tool for trans people to safely walk through the world expressing the gender they have. Lexie, you had a point, I think, about it, so it would be great if you can add to it so I don't sound too crazy.
Yeah, you did amazing. Two things I would love to add to that. One is, I think one of my other mental barriers around, it's not even a mental barrier, it's a societal barrier, honestly, around medically transitioning, is that I know right now I pass as like, oh, weird girl, or like a weird kind of girl, but like charming in its own objectifying way. And I know that if I were to medically transition, I would still want to wear a lot of the same clothes I currently wear. And that includes like things that are sparkly or show my stomach, or like things that are coded as feminine. And I have a really deep awareness, especially with the friends I had growing up, that expressing myself and being perceived by society as an effeminate man in some ways can be just as dangerous, if not more dangerous, than being a weird girl. And I'm afraid of that. And I probably also have my own internalized homophobia as well around that. But I think most of all, I'm afraid of the reality of being like an effeminate boy walking down the street in a way that is more visible. Yeah. And I think part of that issue is like we live in a world where masculinity is considered neutral. And so any marker of femininity is considered to be like a flag of some sort. And it's it's complicated. Another thing I wanted to extend off of that Charlie shared is the idea of surgeries and how it can be a really beautiful affirming experience, and then there can also be surgery experiences that can hurt someone further. And in my case, a few years ago I was fundraising to get top surgery, and I was really excited about it. And I found a place that was giving free consultations in New York City, which is where I was living at the time. And I found that this place did not specialize in trans identity. Instead, it was like an additional thing they learned because it's hot right now, sort of like BS. And so when I got there, it was a lot of like really revealing like before and after pictures, where I think if a place is actually trans affirming, they wouldn't show a before picture. And so I went into the office, and and this doctor felt me up, and I felt so bad after that, because I had it in my head of like, oh, like, was that a part of the experience? Like, was that necessary? Like, was he supposed to do that in order for me to have this thing? And then at the same time, I was dating the person who was experiencing a lot of internalized homophobia and strongly discouraged me from continuing looking for it. And that was also a sexually abusive relationship, so I couldn't tell them about what happened because they would be offended, or I don't know, or take it too lightly. All this to say that like the journey of transitioning to like according to society as a whole can be so toxic and full of abuse, not just from people we date, but doctors, people we're supposed to trust. And that again leads to what Devin-Norelle presented at the beginning of this, of police, of like, I can't trust a doctor who is like supposed to be performing a surgery that is for trans people. So it's there's a lot of layers of distrust and a lot of layers of asking for help and not asking for help, and that happens at every age. I know I'm talking a lot. I'll just say one more thing, and I think is a part of my childhood abuse was a lot of it revolved around my hair. And so like I would get like pulled by my hair a lot, where the person who was the most sexually abusive towards me would cut my hair and would say comments like, oh, like, I'll never let you have a boy's haircut. I'll never let you like have anything boyish. And I think that again is internalized homophobia and this sort of thing of like trans kids, including like trans boys, are very susceptible to violence because there's this additional layer of shame that the perpetrator can have, which is being attracted to something that's boyish, but it's not really a boy. Giant air quotes there, but yeah. Anyways, I just said a million things.
That makes
I
so
just
much.
want to interject. Oh, I'm so sorry, Charlie. Go ahead.
I'll take a note and I'll come after you. Go on.
Okay. Yeah, I just wanted to, something that Lexie mentioned in terms of like how different layers of layers of transition can be toxic, and really the idea that you should, or you can only be trans in the first place by transitioning, by medically transitioning specifically, is toxic in and of itself. And it is toxic because, one, that's not true, and two, something that was dictated by doctors who were not trans. The people who should be making these decisions or explaining what it's like to be trans are trans people, not doctors. Yes, doctors can help us get to where we want to go if, say, we are experiencing dysphoria, but a lot of trans people experience euphoria in which they find happiness identifying as they do, and identifying within a body that they were born in. There are many people who are trans men and will tell you, my breasts make me a trans man and I don't need surgery, etc. I am experiencing euphoria as I am. And so the whole notion that you are required to medically transition is toxic in and of itself. And it's a trajectory that we, or at least a storyline that we need to not necessarily get rid of, but stop applying to all trans people, so that we can understand trans people are not a monolith, and our experiences and how we look at ourselves and our bodies are all going to be different always. Sorry, go ahead, your turn, Charlie.
I think we lost Charlie temporarily.
Yeah, he vanished.
Oh, dang.
One of the things that listening to, especially to what you've just been talking about, it seems to me, I don't know if there are any trans doctors, but I suppose there may be, but
there are some now, yes, definitely.
Pardon me?
There are some trans surgeons now, yes. There's actually a surgeon in Maryland who's a trans woman who has been performing gender affirmation surgeries for a few years now.
Yeah, but it seems to me that it raises the question of, how do you get help? Where do you go? And one of the things that, listening to you, Lexie, when you're talking about going to that surgeon, is I wonder if that man, that doctor, doesn't need to be informed, doesn't need to be educated, doesn't need to be confronted about how he dealt with you, or how he deals with anyone who's a trans person, and not someone who wants to have breast augmentation or reduction for their own aesthetic feminine need or whatever, but is really undergoing medical transition that way. How do we do that? How do we make help available and make the help helpful? Anyone want to answer?
I can respond to that. I also I got a message from Charlie saying that he's back in. You see him?
Lee's going to do his magic and let him in.
Oh, amazing.
I'm
Thank you.
working on it. I did send him an email, but he's got a link that should just put him right back in. But I got my eyes open.
Okay, I hope he gets it.
Cool. Devin-Norelle, would you be open to responding to this first, so I can respond to Charlie's text?
Yeah,
Or can we repeat the question?
Yeah, let's repeat the question. That's where I think
was it about asking for help, or like how to navigate asking for help?
Yeah, how do you ask for help? Where do you go for help? How do you help the helpers? Because I remember being a medical student and having someone come in who actually wanted to have, he wanted to trans to a woman. And it was something that almost nobody, this is at Stanford, almost nobody had ever had any experience with that question, let alone with what you do. And I think that's part of what people in the medical field and especially therapists and psychiatrists really need to be trained, if not, and really well informed and become aware and really empathetic and sympathetic, and so that they could be helpful instead of being maybe unintentionally abusive. I don't know. I mean, I don't know.
Oh, sorry, I didn't mean to interrupt you.
I was just gonna say, I don't know whether that surgeon that you saw, Lexie, wasn't doing an exam to determine what the surgery would need, but he didn't really explain what he was doing, obviously, nor make you feel at all comfortable, which is what any doctor should do, no matter what. But I think still they need to have a different approach to people who are transitioning rather than, going for aesthetic reasons.
I could say from having, I was actually a little wrong in terms of saying I know of one trans surgeon. I actually know of more. I can't think of their actual names, but within the city of New York, within places like San Francisco, there are actual programs where training has been done so that there are transgender programs specifically where training has been done. So when you go into this office, the doctor will know how to address you by your name, your appropriate name, not then name you, how to use your appropriate pronouns, essentially validate you and your experience as you're at the office, which is something that should happen regardless if you're trans or not, right? The good thing is that not only are the staff members receiving the appropriate training, but a lot of these staff members are also trans. I'm specifically thinking about two programs, one at New York University Hospital, and a second at what was formerly Beth Israel, which is now I think Mount Sinai. I can't remember. They've taken over the city at this point. And they have trans-specific programs where you can go in and request. And I think these things are also covered by most health insurance and definitely Medicaid. We can go in and say, hey, like I need this, I want this, what can I do? And they have a step-by-step guide / program where I don't know if in New York you need therapy anymore to obtain, or a doctor's note to obtain hormone replacement therapy. I don't think in New York, but I know in other states, these things still exist. The upside is, now that I mentioned that, we're lucky, or I'm lucky to live in New York and to have these resources. But I know that in some place like Salt Lake City, Utah, it probably doesn't exist. However, clinics like Howland Lord, and thankfully because of social media, can now reach clients all the way out in the Midwest, all the way out in the South where these resources might not exist, and kind of guide them or provide that information. So if you go onto the internet and Google it, what should I do first? It will be there. It wasn't there. I'd say it would have been better for me. I started medically transitioning in 2013, and a lot of information already existed, but most of it did not. Had I started transitioning within this past year, and had I lived in North Dakota, I would have been far better off in North Dakota with the information that's available now than in living in New York City and going to get my top surgery in Florida like I did in 2013. The resources are there. Google is excellent. There are websites called Susan's Place, Transbucket, and there is another website that is slipping my mind that hosts a humongous nationwide list of surgeons across the nation, and threads and boards where you can talk to other trans people about what steps you need to take. I need advice. Do you mind speaking to me? I need to talk to someone that's not a therapist. Who's the best surgeon to go to get top or bottom surgery? I can't get a therapist, but how can I obtain therapy? One of the benefits of the pandemic, and I would rarely say that, is that everything is virtual now. You can make your doctor's appointments virtual. So if you need a trans-affirming therapist, you can now obtain one of those through virtual therapy. I'm in North Dakota, but I can obtain a therapist in New York City that won't invalidate me, which is incredible. I couldn't imagine that happening in 2013, even though we had the likes of Skype. And so the resources are available now, and that's how you would go about doing it. But if you wanted to see someone in person, specifically if you live in New York City and wanted to talk to a doctor and wanted a trained surgeon, those programs now exist for trans people, at least at NYU and at what was formerly Beth Israel at Mount Sinai.
Well, we're running nearly to the end. One of the topics we didn't get to, and obviously won't be able to say that much about, but it's important, I think one of you mentioned I think you did, Devin-Norelle, about suicide among trans community, and that trans men have a higher suicide attempt rate than even trans women, and it's something like 50%, which is staggering.
Yeah, it's over 50% attempt rate for trans teenage boys.
Yeah. What should we do about that? What can we do?
Gosh. Honestly, I think it's related to everything we've already talked about, especially towards the beginning of this conversation, of shifting what does masculinity overall look like. Because if, like we said before, like in this imagined binary world, trans people receive extra pressure to perform or to overextend the genders, the binary genders, in order to be considered real. So for trans boys, that is extra pressure to be the lone wolf, the person with no feelings, the strongest, just like all of these things that can be counter to being an emotional human who can ask for help, which leads to your previous question as well. And it's hard because I think it's related to role models, or lack of role models. It's related to community, and something that I've heard a lot of my trans women friends talk about is the power of sisterhood. There's nothing like sisterhood. There's nothing like sisterhood, and honestly, I'm so jealous of. I miss sisterhood before I started more openly navigating my gender journey. I think there are a lot of factors. So I would love to open it up to other people, but I want to say one more thing, and I think related to asking for help, I really appreciate, Devin-Norelle, how you talked about it being regional to a degree, because I grew up in Michigan and Ohio, and it's so wildly different in terms of the feeling of resources and possibility. And even since I've left those places, I've ingrained those sort of feelings, or even the Midwestern mentality of being as easy as possible for other people to understand, or to like, let's make life easy. And I think that's an element of whiteness too, of course, of being like, oh, like, how do I just bow to whatever.
Well, listen, I think unfortunately I have to interrupt because we're running out of time. I don't know if we are providing a chat room in the MaleSurvivor discussion forum. Do you know, Lee?
I am not sure if we are, but I can jump over there and check it out. To participate in the chat, you have to be registered on MaleSurvivor. I know that. So
you can register anonymously or under a different name or whatever. And
I would like to.
Sorry, sorry, I don't mean to interrupt, but I don't want to have the last word in this, and I would love to even if it was just for like a minute or two, to give Devin-Norelle and Charlie like at least a minute to say any closing words or expand on that really important question, if that's possible. I know we're 3 minutes over, but I just wanted to advocate for that. Is that possible?
Can someone just repeat the question one more time?
It was about suicide.
Oh, yes. I actually did not know that that was the suicide rate for trans masculine people, and I'm both. I feel really hurt actually just hearing that, to say that the least, but also not surprised. To that extent, I think that what needs to be talked about more in all communities is the fact that trans masculine people are so often erased because of masculinity, because we're not deemed as real men, right? Or it is so easy for trans masculine people to become stuff and to quote unquote blend in. And so I think this just talks more loudly to the fact that we need to have more conversations like this.
Charlie?
I do think that transphobia is institutionalized, is everywhere where we go. As much as I said that my medical transition has changed my life in a very positive way, from extreme to extreme, to get there was extremely painful. My doctor of 6 years dropped me. I had to wait 8 months to find someone to prescribe me testosterone. And then after a year of waiting in the Canadian system, I went through exactly what you went through, Lexie. I got dressed, like I took my clothes off, pictures were taken, and after all of the process, I was told, there is nothing we can do for you. There is no budget until 2021. Go figure it out yourself. And I had to take care of it on my own. So I would like us not to get the idea that it goes just by regions. This is worldwide. And this has to be a lot also with representation, how people see us on the screen, on the news, what image the collective is making of us. Because like Devin-Norelle said, we are objects. There is doctor analyzing us. There is not the trans perspective. It's other people talking about ourselves. And of course, when we are rejected in the institutions that are supposed to take care of us, and all we see of us on the screen is violence, how can we think that we have a chance? So, Murray, to your question, how do we fight this? I think that we need something big, just like what is happening with Black Lives Matter. We need to take a stand and ask for justice and ask for equal rights. We should be able to go to a doctor and have our name right, our pronouns right, and decent healthcare, just like everybody else. At the very least in Canada, when I said this.
With that, I think, thank you. I have to thank all three of you immensely for being here, sharing, for educating us, informing us, sharing your stories, and I'm so grateful for you. And we will try to open a chat room on the MaleSurvivor.org website. You go on the website, go to hit this discussion forum, register, and then we'll set up a chat room where people can chat, you know, by typing. And if you go there, you can, anyone who's attending can join in that discussion. And we hope to see you all again soon. And thank you very much. Take care.
Thank you, everyone.
Yes. Thank you very much. And I got Charlie in a freeze frame with his hand up. Did you want to say something, Charlie?
Oh, no.
Sorry, there is just a question in the chat if this recording will be available. So I think that will be good too.
Yes, it will be on the MaleSurvivor YouTube channel. So you just go YouTube MaleSurvivor and you'll find our channel and it'll be up there.
Yeah, I'll try to open up a chat room. I'll try to make it an obvious name. Probably something with the word webinar in it, the recent webinar. So when you go to the chat room, you'll see the rooms, and I'll try to put up a link to our YouTube channel so that when we do get this up on YouTube, it may take a couple of days, that you'll have a link to be able to find where the webinars on YouTube are. Okay. Yeah. And the other thing I wanted to say was we did have a couple of questions from the attendees, and we're sorry we didn't get to those. But listening to how thorough and really touching this conversation was, it really hit a lot of those points. And so if anybody does still have questions, maybe you can meet us in the chat room. Again, it's forum.malesurvivor.org. And if you're not a registered member of MaleSurvivor, it's a relatively simple and quick process. And you can use any username you want, be anonymous, and just hop right into chat.
Thank you. Bye now.
Thank you.
Bye.
Thank
Thank
you.
you for
Bye.
having me.